Hello, my name is Dale Gunter. I am the principal investigator for the McMaster Pain Assistant, which is a clinical decision support system that's been developed for the Oscar EMR. I am working with a wonderful team of clinicians, researchers, and programmer who have been developing this module for some time. I'd like to show you just a few of the key features of this module in the next few minutes. To begin, what you see here before you is the scheduling screen for Oscar in version 12.1. If you're not familiar with Oscar, this is where your day would begin and how you would know who's coming in to see you. So today I have a patient coming in named Pain Test, and I will click on the E, which is the E chart, and that's what will open. This is the typical look, which some of you will be familiar with, of the E chart for any patient. In the center here is our progress note section, or as we call it, the toilet roll, and where free text can be entered for any visit. Over on the left, I want to show you a few of the tools, and here under measurement section, where we have a variety of flow sheets and other measurement items that are kept. There's a new feature which most of you will not have seen yet called Health Tracker. I'm going to click and open Health Tracker. Now, the intent of Health Tracker was to bring all of chronic disease management into one space so that we have a primary care friendly approach to all of chronic disease management, including pain. So across the top here you can see the different chronic diseases: hypertension, CHF, chronic kidney disease, and this is Periodic Health Visit, a module that is being developed by us currently. And you can tell on blue that what we're open to is my home screen. The home screen has been customized by myself to have just exactly the measurements that I want to have open for every single patient, and anyone can do that to suit their own preferences. In my case, weight, smoking, pain, and function will show up for every single patient. So these chronic diseases that are already showing in this toolbar are ones where the person has been registered as having that disease. In other words, it will be searchable, it will be usable for research purposes. It will be easy to make reports on patients who have had their chronic diseases registered in this way. I don't see pain here, but this person is coming in with pain today, and so I'm going to look over here in the undiagnosed flow sheets list, and here I find the pain list. So if I click on this, I instantly get a warning saying I haven't yet registered this person as having some form of pain. Do I want to do that? If I don't want to, I can continue on and use the tool, but it would be wise to do that as it will give us good data hygiene in general. So I'm going to choose chronic pain for this person. And now I get back to the tool. And now we have a group of measurements that are have been selected by our group as relevant to chronic pain management. Again, this will be a default group of measurements and can be customized by anyone to suit their preferences as well. So I'll just show you through those for a moment. These measurements can be entered from the data entry section, and scores can be put in, for example, with the brief pain inventory when they've been written out by a patient or, on paper, or available in other ways, or they will automatically populate from the electronic version of the questionnaire, which I will walk you through in a moment. Once they are entered, you can see the scores here, you can look at a graph of the score, and you can also print that graph, give to the patient, or include with your consult note, whatever is of use to you. That's how the measurements work. Some of the measurements populate directly from lab results or from other sections of the health tracker. So weight may have been entered somewhere else and it will be populated. Height and BMI. Drinks per week may have been entered somewhere else, and A1C from somewhere else, and so on. Those will cross-populate. Moving over to the right, we have a set of tabs that give us access to some other tools. I'm going to point out that in Oscar 14, which is going to be coming soon this year. The entire look of Oscar will be much more like what you see here in Health Tracker rather than the look that you just saw in the progress notes section of the chart. In other words, there will not be windows that keep opening and overlapping, but rather tabs and all of these sections will show at the same time, and will show along with the CPP and the other features of the regular chart. So I'm going to take your attention down to the lower right here where we have the pain toolkit. What is highlighted is the completed documents, and here we have a brief pain inventory, lower back pain guides, neuropathic pain guide, and these were completed on these specific dates. So these are actually the progress notes, the assessments, the management plans about those visits, and are all that need to be included for somebody when they've had an assessment like this. But I will take you over to templates, which is the fresh versions, and we'll walk through a couple of these together to show you what's involved. So in this list, which this list contains two different kinds of tools. One is what are called encounter guides, and one is for low back pain, the other is for neuropathic pain. At this point in time we have these two, and the sky is the limit on how many others could be developed. So you could imagine something for headache, for fibromyalgia, etc. And they're really just step-by-step guides that go through an assessment and management plan for any individual patient. In addition, there are others like brief pain inventory, goal planner, mood, sleep questionnaire, trauma, and any of these can be used or not used. This is really a very flexible system, a suite of tools that somebody can use to their preference. Now I'm going to open up the brief pain inventory to show you a little bit of what this looks like. First of all, I want you to notice the shape, which is designed to work with any mobile device, and will also fit nicely into the new user interface of Oscar 14. I would also like to show you that the graphing function is electronic and digital, and so we can draw the area of pain on this picture, and it will save for us in that format. The questions, as they are answered, automatically tally up, and when this is finally completed, our brief pain inventory score, both for pain and for function, separately will have been added up. If you're not sure about what the score means, there's a scoring description below, and then a how to interpret the score below that. We have the citation for the source of all of the different questionnaires. None of our questionnaires have been developed de novo. They are all from the literature and have been validated in a variety of ways. So finally, you can save this document, which will now stay in your chart as a progress note of its own. You can print the document. You can give this to the patient or send it with your referral to your consultant. So I will just save this at the moment. We are asked to be reminded that we should save, and that score will go in over here on the left, as you can see. Now I'll walk you briefly through the neuropathic pain guide. Similar idea. We have the assessment section where you can free text as much as you want. We have a DN4 questionnaire which can be opened or closed and gives you a 60-second approach to diagnosing neuropathic pain. Again, that score will land over here in the measurement section. We have a section of different lab results and other measurements that may have been assessed in other chronic diseases, which will populate here for you. If they have not been assessed before, then you can enter new values here on your own. We have a summary of assessment and then a management plan. In this case, we have decided to include mainly first, second, third, and fourth line medication recommendations from the Canadian guidelines on neuropathic pain. And you can choose to either be triggered for which ones you want to use and indicate what you've chosen with the tick boxes, or you can get more information by opening up the section called Prescribing Information, and here you'll see how to dose and monitor each of the medications. So you can see that a clinician who is brand new to this field, a first-year resident, might use everything that is available, and a clinician who is experienced and knows what they're doing might use this simply as a place to record information about their patient. There are many different levels at which you can connect with this tool. Finally, there are links in each module to a variety of tools, and here, for example, under patient handout, we've linked to the Australia chronic pain video, and this could be played by the patient on their own, could be played in the room, and could be played by yourself at any time.
Everyone agrees that pain is a universal human experience.
These can be personalized to your own preference. Also, in this case, this is the only one on this encounter guide. I'm going to show you one more, and that is the low back pain encounter guide. The low back pain encounter guide again has free text assessment. We can decide that this is an acute problem, which will trigger a number of other decision supports down the way. And then notice that in the assessment section we have a number of tools that are currently closed, but as you open them up, you can decide to use all or none of these tools and record what you wish. The assessment section and management section have all been taken from guidelines that have already been developed, including Top Alberta Doctors and the Isaac Low Back Pain Program in Ontario. So we have, again, created none of this de novo. We've simply pulled it together and formatted it in a way that it's hopefully more useful for everybody. We can make a management plan here. Again, we can view details about the analgesics if we wish and what we might be using, and provide a summary for the management here. We have links for physicians and other clinicians and patients, and back at the top here we had a link for the physical exam at Top Alberta Doctors. What you don't see on this yet, but which is in process right now, are a collection of very short 60-second videos which will be recorded by experts in the field and will be placed within these encounter guides where specifically difficult decision points exist for both clinicians and for patients. So for example, when to refer to a surgeon would have a 60-second clip that pertains to both patient and clinician that could be played in the midst of the clinical encounter, and which would be instructive to both and might help them to come to the same understanding about the appropriateness of diagnostic imaging, of referral, of exercise and rest, and so on. I will end this presentation here. I hope that you have fun playing with this module, and we really look forward to everybody's feedback on on what you've seen. Thanks very much.